for Dr. Jason D as he goes up the stage. Jason, all yours.
Decide.
Up to.
Thank you very much. Very good morning. Okay, I'll sit here. All right, very good morning, everyone. So all of you who are here today in this hall, you guys are in the perfect hall. So this hall 1, hall 2 on the other side, probably not that interesting. They can use ChatGPT or any of the tools to kind of figure out what we're trying to discuss here today. So, all right. So, welcome to our session on Gen AI in healthcare and what's next for doctors. Now, this session is very important. And before that, can I just get a quick show of hands? How many of you here are doctors, at least? Okay, keep your hands up. How many here still in the process of becoming doctors? Medical students as well. So none. All of you are practicing doctors? Can I assume that? Okay. How many of you here are still in housemanship? Okay. How many of you here are with MOH? Okay. How many of you here are with the private hospital or GP clinics? Okay, what about the rest then? Are you guys not practicing at the moment? Okay, so those of you who are not, this session is perfect because right after today, you probably can use Gen AI to start your own practice. Alright, okay, so today we are fortunate to have two distinguished panelists who will bring perspectives from tech innovation, academic leadership, and frontline clinical practice. So the panelists are clinicians, they are practicing clinicians. One of them is a surgeon. They will help us unpack the promises, risk, steps forward for doctors heading to the new era. Alright, so let's welcome. First, we have Dr. Ahmad Syahid Fadzil he's the Deputy Dean of School of Digital Health from KPJ Healthcare University. So Dr. Ahmad Syahid, please take the stage. And next, we have Professor Dr Vicknes Waran, a neurosurgeon, surgical trainer and inventor, technopreneur and administrator. So please take a seat. Thank you. Okay, so those of you with your phones, you can start running the ChatGPT search right now to see who they are. Okay, so I believe this discussion will be very interesting. I will let the both of you to introduce yourselves first. So Dr. Ahmad Syahid, you can go ahead and introduce yourself.
Right. Assalamualaikum and very good. Can
you guys hear it?
Can you hear me at the back? Alright, thank you so much. My name is Dr. Ahmad Syahid Mohd Fadzil. Currently, I'm the Deputy Dean of School of Digital Health in KPJ Healthcare University. This is the first School of Digital Health in Malaysia and Southeast Asia. Right? And then the ideation was last year for us to establish the School of Digital Health, in which we indulge. When I use indulge, usually it is from ChatGPT. Okay, we indulge in AI, digital health, and robotics as well. And apart from that, I'm also a practicing physician and sport cardiologist. And apart from that, I'm also a royal watchmaker. I make watches for our Tuanku Agong. That's about it. Yeah, I'm a Swiss and UK certified watchmaker.
You are a watchmaker as well.
Yeah, but that I don't wear anymore.
Well, give a big round of applause.
That's how we disrupt the doctors. Please, sir? Yeah.
Yeah, thank you so much. Yeah, Dr. Prof, you want to introduce it? Is it working?
Can you hear me? Okay, so I'm Vicknes Waran, better known as Vicky. So I was a medical officer, I was a doctor, became a neurosurgeon. I was responsible for setting up the neurosurgical unit in University Malaya. I went on to, for the sins I did in my life, I was asked to then administer the surgical department in University Malaya. I went on to become medical director of UMSC, CEO of UMSC. But my neurosurgical career was just one small aspect. I wore multiple hats. The other things that I do, I've been involved in tech for a long time. And basically my approach to tech is there are lots of technology available on the shelf. A lot of this can address the pain points in our daily care of patients, our work and stuff like that, so I started doing it. The high point of my career was in tech, especially was when I had papers published in engineering, when we were involved in 3D printing in healthcare. We were way ahead of the game. So we were making models. I can scan any one of you and make you in your likeness. And if you had a tumor in your brain, I could make that tumor and I can make people operate on it. So that's where we were at that point. The other interest is in telemedicine, and more recently, this AI like everybody else. Thank you.
All right, thank you very much. So, Dr. Vicky mentioned about 3D model printing, right? So, how many of you here played with Nano Banana? Did I pronounce it right? Nano Banana, right?
Yeah.
Yeah, how many of you here played with Nano Banana? Or do you guys even have any idea what it means? Only one person? Nano Banana, the one by... So you guys are in Gen AI forum, but do you guys play with any of the tools? Gen AI tools? Alright. No, because Nano Banana was one of the tools where you generate 3D models of yourself. Yeah. So you guys were ahead those days, right?
No, we were serious.
Serious?
So I printed my own brain, 3D printed my own brain, and I held it in my hand and I said, I'm the first man to hold his own brain in his hand, right? Yeah. So we had real models, so we can actually operate on them, we can actually do an entire procedure. Yeah. And this was in 2013.
Okay. Yeah. So one fun fact as well, I think before we start, I just want to make sure I don't forget. How many of you here uses the old Nokia handphones back in the days? How many of you?
The old one with the
Okay, the old ones. Okay. How many of you have ever sent? So those with the hands up. How many of you has ever sent an MMS? You guys sure? You guys know what's MMS or not? Not SMS, you know. MMS. MMS. Your most primitive form of image sending back in those days. Yeah, you guys send it. So Prof Vicky was one of the first person to send diagnostic images using MMS back in those days.
Actually, I wasn't the first. But what we did was we actually validated that you can send images initially by SMS. This was in 2007 or 9 or something like that. And then later we repeated it using MMS to do emergency consultations for patients, neurosurgical patients who had sustained head injury in the periphery. So by 2010, I was very proudly used to say that any patient that comes to University Hospital at that point would have had a neurosurgeon having looked at the images, not just someone describing the images. So we actually validated it and they were published in Tier 1 journals at that point. So we actually validated it. And then we'll take it one step further, is that when the COVID happened, we were the first to come off the bat to show that smart glasses could be used for long distance consultation. And we ran it on 100 patients, 10 encounters, and came out in world neurosurgery. So there's a lot of technology available on shelf. It's just a case of using it. And leading off, I think AI is the same thing. It's an off-shelf technology. How is it that you're going to use it?
All right, I'm going to ask you more questions on that as we progress. Okay, so I'm going to begin. So, Dr. Syahid, from an academia perspective, how do you think medical education has evolved, and how do you think they should prepare future doctors coming ahead?
All right, thank you for the question. Of course, I take this from the academic perspective. Generative AI, in which we can create and we can nowadays we can predict, we can propose, and then we can also generate new things, text, images, videos. Recently we have multimodalities, meaning we can take everything together, right? In comparison to even 1 or 2 years ago. From the academic standpoint, one thing the future doctors or even I think junior doctors should be able to understand what generative AI is, at least at this point of usage, meaning generative AI was being introduced quite a long time ago, but it was only being introduced en masse about 2 years after, especially after COVID situation, meaning digitalization being accelerated, etc. And then when ChatGPT was introduced by OpenAI, right, they want to collect inputs for training, so they make it free so everybody will come on board and use it. Academics, I would say in medical, especially in medical ecosystem, they don't really, they have a little bit of apprehension of using it at first, because I think knowledge and medicine comes in hands, and then when there's something that we can generate new or can cause some contradiction with what we have learned and practices before, that can be like a commotion, or it's like a conundrum for most of the academics. One thing, the academic institution must know how capable they are in adopting generative AI. One is very important. Right? And number two is that the academics must be updated, especially on the technology, because it is very dynamic, it's very fast. What was available 1 week ago, 1 month ago, now it become a level 2 or level 3 technology already, right? And then the advancement also very dynamic. We have from ChatGPT 3.5, 4, 5. Now with reasoning, which is another level of intelligence for the computers. Next will be the assessment for the academics, especially for the students. For medical education, or medical perspective, the assessment now, at KPJ Healthcare University, we are now indulging or engaging in a common, or what you call particular general umum, meaning general study for all the students, nursing, medical, pharmacies, in which we plan and then we map the program, each program, with the suitable AI or generative AI modules. And then we assess them using either OSCE style, and then also with the, like when they want to learn how to code, especially from the current style of coding with white coding, so we can assess them with that. Apart from that, the regulations, meaning from the academic standpoint, it is very important for these students, especially the junior doctors or medical students, to get certified or verified with their generative AI skills. So I think that will not only enhance their confidence in using it, but also we can include the responsible and also ethical AI in that as well. So I think that's about it.
Okay, so medical school for me was 20 years ago, probably longer for Prof Vicky. So I want to know, in the syllabus, do you include using these tools as one of the syllabus, and then you what you call that? You grade them on it, or you assess how well they use the tools to come up with an answer and diagnosis, whatever syndrome, combination of multiple symptoms that. So how do you put it into the education syllabus?
Okay. The first thing, we have to look at the M2A accreditation, meaning if we want to make it elective or compulsory or core subject, right? So we need to follow the guide. Fortunately or unfortunately for the rest, we still yet to have the AI program standard. I think it will be coming in late October this year. So what we are doing now, we are experimenting with the modules, meaning we are using not only the theoretical part, but also the practical part, using all the tools that is available and verified, because we don't want the sensitive data or student data to be used as a training input for these tools, right? And then the assessment wise, okay, if they are learning programming, coding, nowadays very, very easy to code, right? The CEO of NVIDIA, right, Mr. Jensen also said, okay, you do not have to be a programmer or coder for you to understand what generative AI, or if you want to be an AI program or you want to build your own LLM. But the important is that you understand the concept, a little bit of physics, statistics, and mathematics, and then you can actually pursue in that pathway. What we are doing now is that we are disrupting the tentative pathway for the students. We're creating a new option for them to go. Meaning, okay, I'm a pharmacist, but I'm interested in AI. Right, okay, after my bachelor, what can I do? We are now going to offer the MSc in AI for healthcare. The first one in Malaysia, the first one in Southeast Asia. We include there, thank you, Puan. We include them in the programming, because one thing that I always see is that the gap, clinicians are a little bit apprehensive or they are scared to go into this AI domain, learning that they have to learn how to code. You need to program. Essentially, yes, but in reality, no. As long as you can understand the concept, that's what we are trying to prove at KPJU. We want to get a shortcut for this, but then not to miss the essential part of it. Meaning, in terms of assessment, they need to code, they need to produce code, but nowadays you can go to ChatGPT or any GPT or any large language model algorithm, right? You can go in there, and then you can actually create a code just by communicating with it, and then you just can copy the code and go into the launch pad. So I think it's quite easy. And then what time for us to live. And then just to add a little bit, our MSc in AI for healthcare, the doctors are my priority because I want that bridge to, I want to create that bridge. Doctors come to AI. We have my dean is a computer engineer, Prof Faisal. He is a master in computer vision and also pattern recognition. And then we have, I think we have one of the best group of academics, at least in Malaysia for now.
Okay. I have one short question on that, which I want to extend it to Prof Vicky to answer as well. So very quickly, coming back to the syllabus and the whole thing, so from as an university, do you train medical students to kind of like to use it in the clinical setting? I mean, all this, you know, it's fancy to say that, okay, this is a master program for digital health or whatnot.
Yep.
But do you train them, do you train these students to use it when they are facing their patients, when they're clocking their patients, when they're diagnosing, putting management plan, order, care plans and whatnot? So is that part of the training?
Yeah.
It is
one.
Okay.
Actually, it's one of the critical part of training. But first, we do it in a controlled environment, a safe environment, in which we have. I'm now currently developing a state-of-the-art Center for Digital Health for KPJ, right? So the students or the doctors can go there and then they can play around. It's like a sandbox for you to test your clinical ability, especially in using generative AI. No, in a very safe environment, but we are utilizing our best strategic advantage at KPJ. We have 30 hospitals, right? Real data, 40 years of data. We can actually use them to train these doctors because, of course, according to many of the tech giants, right, including OpenAI, when they launched HealthBench this year, the issue is that generative AI, when we play with the good structured data, the clean data, right, it can produce this very nice output using generative AI. But then, when it comes to the real data, which is unstructured, we are talking about public healthcare, right? Private entities. Still, it can produce a less convincible output, meaning the outcome is not as expected as we play with the clean data. When we come into the public data set, I think that will become more troublesome.
Okay.
But then, yes, we are including that, not only in the simulation, with their capstone project, right? They need to go and face the real deal. They need to go to the hospitals, in which we are very fortunate to have, and then they can play with the data there, at the bedside. and then get involved with the patients.
So on that note, Prof, so as a surgeon, every day, you are practicing as well. So nowadays you see a lot of new doctors, housemen. I don't know whether you still work with housemen or not, but so how do you see this changing the practice? So probably two perspectives: as a surgeon, someone supervising, and all your MOs and your husbands who are co-managing the patients as well. How do you see that changed?
So, I find this whole hoo-ha over AI fascinating, right? I just find it fascinating. I'm a doctor. I'm not an IT person. I'm not a technologist. There's this technology available. It's a case of how I'm going to use it, right? Were we worried when Microsoft came up with PowerPoint? We were not. When he came up with Word, we were not. Did we make a big fuss about it? Now I can type words, I can correct immediately. Now I can put color, I can put picture. Did we make a fuss about it? We didn't, kan? I didn't go for any Microsoft, PowerPoint, Excel. I wish I had gone for Excel classes, okay? Because that's one thing I wished. But we used it. Then, fast forward, Google came along. Were we worried about Google? There was a lot of people who said, you can Google this, you can Google that. Whether you train people to use Google or not, it started off with porn, and then they went on to other things, right? So, Google evolved. Now, what is AI? In my opinion, AI is Google on steroids, right? And it's easy now to ask. So when people get concerned, the patients are coming and they know about their illness, hello, they were Googling this long time ago already. Right? They were Googling this a long time ago. Now the only thing is they don't have to Google 3 days in advance. They can sit outside my clinic and AI that immediately. The reason I did surgery, honestly, was because I only needed to know, especially neurosurgery, I only needed to know the name of 3 drugs and the side effects. Right? Otherwise, if I was going to use something different, when they went out, I will Google the thing and the dosage and side effects after they have left. Now I have to be a little bit more worried because they'll come in already AI competent. So I just have to be honest enough to be able to tell the patient, listen, I need to check on this, I don't know, right? And it's easy. So we have actually democratized knowledge. And I think that is what, as doctors, we are worried about. That we have democratized knowledge, everybody can find out. Of course, there are influencers out there who will feed you crap like don't take vaccines, but they were doing it even as Google. And the makcik next door was doing it 50 years ago to your mother who was explaining, jangan makan tu ubat ya. Cuba pandan ke apa ke ya. It's always happened. Except now, the reach is far wider. As far as training my doctors concerned, I encourage them to use it. Okay? My biggest failure in life, I always tell my trainees, I've trained many of them, and I said, my biggest failure in life is never being able to get you fellas to read. And with the newer generation, it's even more difficult. All they want is bite-sized knowledge, kan? So I started using AI to set my questions, but it's my prompt, how I set the questions around a topic. And then I give it to them and I said, you can answer, you can use AI, but I want you to read at the end of it. So the questions come out structured in such a way that is more clinically applicable. Honestly, I'm not worried whether they can code or they can't code or what it is, okay? Medical students' assignments, so, if you had gone to UM, you have to write assignments, every posting you have to write 2 case reports and whatever not, and which I personally thought always, when I was a medical student there, I thought it was a waste of time. Right? And somebody was going to read it, and no, these fellas didn't read the bloody thing. So you know what I did in the last few months when I was there? I just chucked it into AI and said, mark this for me, rank it, these are the points I want it to see, and it'll come out for me, beautifully tabled and everything. Then I'd say, shit, this is too easy, I did it in 20 minutes, what would have taken me 1 whole day? I went back and read a few of these things. Okay lah, sounds okay. Got no issue. I asked it to rank over information knowledge. But, as I was telling Jason just now, so we have to come back now to a simple thing, right? I believe that there must be what is called core knowledge. And if you're going to be an educationist or whatever, that's their job, not mine as well. No more mine. So you must know, in event of a nuclear holocaust, and you have no electricity, can you treat this problem? Now there's a catch, right? So we as trainers need to know what is the minimum requirement, okay? And that they must be able to function. I envision a day where you come into an exam hall, you've got two sets of questions. First set of questions you have to sit for is minimum knowledge. And then the next one is how you approach using technology. I grew up in school when, in Form 5, the most we were allowed to use was a logbook. How many of you know what a logbook is? Okay, so some of you do know what a logbook is. Okay, so a logbook, sine, cosine, tangent, triangles, all these things, yeah. Okay. But at Form 6, we were then allowed to use scientific calculators in the exam hall. Remember that? What a jump it was. And we were happily using it. Today, they will be using AI. That's basically my take on it. It's an off-shelf technology. Let them use it. But if you are more senior than them, that's your fear, right? They know more than you. So you either keep up or they drive over you. I'm not sure if I answered the real question.
Yeah, you did.
Okay, all right.
In details. In details. Yeah, but just one question I would like to ask is also, as a surgeon, I'm sure you write your post-surgical notes, your pre-operative assessment or whatnot. So do you use, so the question would be, do you use Gen AI to generate some of your notes? That's the first question. Top up to that, what do you think are the limitations?
I have not actually used it. I should, I suppose, but I've got pretty good EMR in my hospital, so it works quite easily. I'm actually quite curious about these things. So I was using Dragon 10 15 years ago to dictate my notes, because I do a lot of medical legal work, reports and all that. So I used Dragon 10. But I found that I type faster than I can dictate and I have to go back and correct. So that's one problem. I have tried using AI in my clinic to take notes. But we live in Malaysia. We can put 4 languages in one sentence, right? I can have a discussion at home and we can have 3 languages in one sentence. That beats susah, So I think that's some of the issues. I tell you what I use AI for a lot nowadays. So if I'm doing a LinkedIn post, I'll put it in AI, I'll ask it to correct my language. It'll tone down my language, okay, make it so that I don't offend too many people, put in the hashtag, that kind of thing it does well. But I also noticed that it may take that creativity out of me, my style of writing, or my style of discussion. AI tends to damp it down. But then, of course, I tell it, leave my stuff alone, don't, leave it. And then okay, your reflective mode, and then it comes up with something like, But it makes it less offensive if I return it the first time. Yeah? So I've not used it for clinic notes. I've used it a lot for training. I've used it a lot for teaching. The other thing that I use it for AI is, for example, we are supposed to keep up to date and we really don't keep up to date. So I at least I tried it once. I have not. Try again next year. So I said to myself, okay, tell me what are the recent advances, write me about the recent advances in pathology, diagnosis, and treatment of glioblastoma. So he gave me a 1-pager. So now I'm in front of the game. I skipped 20 journals, book chapters, and I've got a 1-pager that tells me. Now, it works for me because I'm the subject matter expert in that area. So it just brings me up to speed. And then I go back and cross-reference to make sure it doesn't talk rubbish, A year ago, I had to talk about, someone thought because I'm neurosurgeon, neuro word is there, talk about dementia and treatment in Penang. Somehow they are neurologist and geriatrician there. The entire presentation, honestly speaking, was done by AI for me, right up to my slides. But it threw all this gene sequencing and medication and all that. So I have to go back and put that all into Google at that point, and ask Google to tell me about all these things. So suddenly, overnight, I became an expert in dementia management. Don't ask me about it, I can't remember. But it made me, but you must understand that steps, you see. A lot of people just do their slides and then they forget about it. They don't go beyond it. But it has made that entire process, I think we have to understand this, it has made that entire long process, I can do in 20 minutes.
Wow, okay.
Yeah. I'm a user. I'm not a programmer. I'm not looking at all those things. I use it. The technology is there.
Okay. So, having said everything that you just mentioned just now, there's always this fear. So coming back to democratization of knowledge, should doctors even be fearful that, this AI stuff is going to replace my profession, we're going to run out of jobs? Thoughts on that, and maybe I'll get your thoughts from an academia perspective. So, Prof, what do you think?
I put up an article on LinkedIn just a few weeks. I'm new in LinkedIn, so addictive. Okay, so I put up an article about what your patient expects from you, right? And if you practice that, right, if patients come to your room, they want you to hold their hand, they want you to listen to you, they don't want you to get them out of the door in 5 minutes, they want you to explain things to them, right? And you must be prepared to do all those things, okay? At the end of the day, how many of you get irritated when you call up something and you're speaking to a machine on the other side, and it just keeps going from, you got 3 options to 2 options to 5 options, and it's just annoying, right? You want another human being on the other side of the line who you can relate to. Okay, so you're going to tell me AI can do that, but I'm not sure, okay? So the same thing patients are going to expect you to do it. Is it going to replace you? The answer is probably not. I don't think so. So someone said, the problem is tech people, and they are the problems, okay? Something will happen and they say AI is going to replace all radiologists, and all radiologists will get very upset. Yeah? But if you think about it, right, if you think about it seriously well, okay, it can diagnose mammograms probably well. It can diagnose chest x-rays. Yeah. Chest x-rays, only chest x-rays for lung nodules. But we send a patient for radiology, we scan from brain to toe and all kinds of pathology and all kinds of different things. It'll probably take over some of it, but it'll take some time because it has to be taught. It has to learn, right? So it's not going to replace a radiologist in the next 5 years or 10 years, So by which time, if the radiologists don't up their game, they are going to get eaten up.
Yeah.
Right?
So is there any radiologists here?
Any radiologist here? Or any radiology MO
or has
here?
Been replaced already?
They are studying AI at the moment.
Okay. So I believe it has somehow simplified a lot of the workflows and, improve, saves a lot of the clinicians' time to do the mundane kind of work. Right. So on that question from an academia standpoint, does your student or the student's parents ever ask the university like, my children gonna have jobs or not in the future if this whole AI thing takes over?
Okay, usually that is the last question from the panelists or the moderator. Right? Is doctors or are doctors going to be replaced by AI? At least not now. Right, and of course there are certain from my academic perspective, because I've been studying about this, because this is one of the most common questions being asked, not only at the local level but also globally. Certain specialties might be affected, right? Pathology, radiology, just because of the advancement of the images being transpired or being translated by AI, which has, there are studies being done that said, AI can supersede what the radiologists in terms of accuracy and also the speed, right? So AI tak payah nak you don't have to pay the radiologists, don't have the AI doesn't have to stop at 24 hours per day, 24/7, and then in terms of health economic side, it will be less costlier, either for the hospitals or even for the healthcare system. But again, in terms of the future, there are more studies being done about this, because this is actually a question that needs to be answered not only by the healthcare providers or the academics institutions, but also the technical side of AI. Meaning, are the engineers or are the programmers going to make something that can replace the doctors or the surgeon even? They are trying to prove that, yes, one day, with now we are at the stage of, artificial general intelligence, meaning we already have smartphones, We already have EVs, right? Autonomous driving, going into Tesla Optimus. Now we are really reaching toward the physical AI part, in which AI will be embedded into a pseudo-living or humanoid form of people. They are expecting by 2027, most households will have one robotic or AI robotic helper, right? To clean the floor, even to take care of your child. Now it costs 250,000 ringgit. In the next 5 years, it will cost around 30,000 ringgit. Right? So we just need to charge this so-called robotic maid. For healthcare, certain repetitive operations or tasks can be replaced by AI, and it is happening as we are having this conversation. Like in KPJ, we are started to use IBM Watson X for I think in a colloquial conversation, meaning one of the thing that Prof has mentioned just now. In Malaysia, we have dialects, right? We have certain, kita ada bahasa rojak. Okay, one of my studies now ongoing is is on building this LLM or neural language processing (NLP) using bahasa rojak. Everyday bahasa pasar. Like what bila pergi mana-mana kan, and then kita cakap, because with patient will not have the medical jargon that we use among ourselves. So they will talk as they are using their dialects, right? And also with our multiracial background as well. Okay, now most of the on-shelf products, they have this what we call the ambience AI, meaning they will take if a doctor and a patient having conversation or in the consultation room, it will dictate and then take the ambience surrounding conversation and put it into text, and then that can become a legible medical documentation. But hallucination, confabulation is very, very high, especially in generative AI, right? The other day, I was using this one, like an AI meeting language to text, and suddenly what I said is that Dumbledore, without any explanation of that, Dumbledore. Dr. Shah, Dumbledore. And then the other, Dr. Shah, I don't like anyone. But then I say it's a totally different thing. But then if they take it as a meeting minute, right? So it's like, why Dr. Shah is talking about Dumbledore suddenly, right? So confabulation and hallucination, meaning nowadays, especially with the advancement of GPT-5, they already included the reasoning part of AI, meaning the AI will take time to think about about your input, what you ask, and I believe they are also testing our patience.
For sure.
I have a lot of not only students, my colleagues, right? This AI now it's like playing with my patients, asking this, say they started, the user will start to respond in certain angrier way, right? And they say, it's not like this lah. But then this is how AI progresses, meaning it start to reason. Why this user giving this kind of feedback to me, right? And what should I say? And then it is also a common belief that if you say salam or hi before you use ChatGPT or any GPT or any generative AI, that particular language or the next conversation will be more tolerable to you, even though if you are angry or make it faster. No, not like this. The table should be like this. No. Okay. It will be more tolerable for you and also for the AI system. So I think, I'm not sure if I'm answering the question just now.
So end up doctors will be arguing with the AI.
Yeah, and then, okay, again, come back to the question. Doctors, certain specialties might be replaced with AI. Now they have this AI remote robotic surgery that can be conducted from thousands of miles away. They are repeating that again next year, I believe, because of this. Now we have 5G, right? Next one will be the 6G. Now we have 100 Mbps. 100 Gbps maximum. But then later it will be like 1 tera. The speed will become much faster, and then the latency between for the remote surgery will become better. And AI, when they start to go into humanoids, I personally, from academic side, it is a very interesting space when I can see what is happening on the academic and also research side, and then also I can see what is being done on the clinical side, right? The discrepancy is there, but then it is like, I agree with what Prof said. Perhaps in the next 5 years, if the dynamic of the technology or the AI advancement is not really fast, it is being stagnant at the moment, right? Doctors might not be replaced yet. Lecturers, most probably. They already tested that in few use cases in countries.
Are you a lecturer yourself?
Yes, I am. But fortunately, I'm indulged in AI, so perhaps I am a little bit safer on that side.
Okay. Right. All right. Okay. Yeah, go ahead, Prof.
Since we are in the mood of getting replaced, right? I think we are fearing the wrong thing. Surgeons are complacent. They think that they are not going to get replaced anytime soon. Today it's robotics that I worry about, and they're not really robotics, they're actually micro-manipulators. And Malaysians, or everybody likes to be treated by someone overseas. Okay, there's some Singaporeans here I see. So Singapore's medicine must be better than Malaysia. Similarly, if I can afford to go to US, it must be better, right? And robotic surgery today, I'm sure you've seen articles, people from here operating on a patient there. If our surgeons, if our doctors are not up to speed, that means they don't realize they are competing now in a world. The world is a village now. We cannot shut things down. We are going to risk becoming a technician where I just will connect the instruments and somebody from Harvard will be operating on the patient. And the Harvard person may be not as well trained as me even, but because he or she is from Harvard, because it's the US, they will pay and have it done. Okay? Now, that is a more likely possibility. That means tomorrow, your consultation, I can have a consult with anybody now. It doesn't have to be a robot. You come and you can consult with somebody overseas. I can do telemedicine. And when we were doing smart glasses, during COVID, we sent the most expendable person into the COVID ward, okay, in ICU with PPE and the smart glasses, and the remaining of us were sitting outside and telling him what to do. He became our bot. Okay, the most junior expendable became our bot. Oh, look at this. Can you show me that? Can you show me this? Right? And we were doing it. Right? We have demonstrated that 5 people can see an operation being done and can comment on it, can be taught on it. And this is not actually AI. This is real eye. Yeah?
Real.
Yeah. So I think that's what we have to worry about.
Yeah.
And then in there, they will throw in AI. AI will learn few things here and there and tell you what to do. That is the bigger, if you ask me, that's the bigger problem. If Malaysians don't up their game, we are going to be walked over.
Agree with that. Okay, so on that note, I believe we allow the audience to ask a couple of questions. I think there's like a pigeonhole QR somewhere. Is it going to be Vishnu? Is there like a QR pigeonhole Q&As application platform?
Because the tech has to do it, I'm not really sure. Never mind. Can we take some questions then?
Okay.
I will pass the mic around.
Yeah.
Anybody wanting to ask any questions?
Yeah, anybody with questions, go ahead. So while you are thinking, while you are generating that question, so I just want to bring up, to add some note very quickly. So I think Steve Jobs, the late Steve Jobs spoke about AI, I think about easily 20, 25, 30 years ago. He mentioned about how AI can actually bring Aristotle back to life. And because we can't go back in time and talk to Aristotle. So now we have the technology to actually ask Aristotle questions, right? So I believe this is where, as all this knowledge is being accumulated, now you have AI companions. So imagine the patients or any one of us are actually talking to the AI companions. So I'm not sure how many of you here uses Grok companion. So you can actually argue with the AI companion, right? You can tell, no, I disagree with you, and then he will give you all kind of weird feedbacks. So I think this is a very interesting phenomenon that we are seeing. So I can kind of visualize the world where everyone will be talking to a companion who is a subject matter experts, who are subject matter experts, right? So, okay, so let's open the floor for questions. Yes.
Assalamualaikum, Doctor. I'm Dr. Wan Julia and the veteran GPs. How I want to adopt AI for my GP practice. What are the simple things so that I don't have, and we know that the facility of AI will be reduce the price. So I don't want to take it now. It's very expensive. Maybe in 10 years it's less. And is any limit age that I'm 62? Is there any thing that should I be your students?
Sisi tu muda lagi, Doktor.
Ada ke?
Muda. Sisi tu muda.
Muda?
Okay. So wait, let's rephrase the question. I think the question is how can AI help GPs? And then will it actually add cost to the practice? And is there an age limitation to doing that? Is that correct? Yeah.
So
maybe I'll let the both of you answer, but Syed can go ahead.
All right, I'll take the easier one. There's no age limit to use AI. I wouldn't say older. My most senior student at the moment, right, is 78 years old. 78 years old. Okay, very easy because like ChatGPT, you can actually activate the voice, like a voice conversation, meaning, and then it is not limited only to English. You can speak Malay or in dialects as well, right? So this particular lady, she's using it for her business, right? Because apart from teaching AI and also digital health, I'm also teaching MBA. So one of my students at MBA is actually, she's a matron. Retired matron, and then she ventured into business. So no age limit. Either on the spectrum from, I think my children started to learn programming in AI when they were 5 years old, right? And then again, there's no age limit. In terms of clinical practice for GP, I think we still need to bind, or still need to be wary of the this year's MMC regulations for ethical use of artificial intelligence for clinical practices. So it is available on their website. So basically, what they want or they emphasize was transparency, meaning if you use AI for consultation, you need to put that in your clinical notes, right? And then you must tell the patient this conversation is assisted by AI. And then the other things that might hinder the clinician to use AI because they need to put in a clinical notes, right? But then there are some, I would say, MMC is not limiting the use of AI, but then just to use it responsibly and ethically. That's about it. ChatGPT, I think most of my GP or even my academic clinician friends are using. But then to this certain extent, which we don't share patient data and also any sensitive data, even for the patient or for the doctors themselves.
All right, thanks for that, Prof. Do you want to answer the previous question? Or? Yeah. A brief one.
Sitting and listening to your question just now. Okay, I'm 60. Right? The guy who taught me AI is 68 or 70. He was my lecturer and now he's so into AI, he's like an AI guru. But listening to you, question, I think disruptive doctors could run a course for GPs to use AI to better manage their clinics. That would be a first course that I think they can put together. And so it's just a case of developing. So if I may disagree. So all this regulation, right, is an overreach. Okay, people feel like we have to control you. Okay, and we are worried for no reason. After all, did we write there, I got my answer from Google? No. I never wrote, right? I never wrote that I got the reference material from BMJ. I didn't write all that down, right? Yeah, I just put it down, right? I mean, I just wrote it down. So why do I really... If you are taking real advice and you're not checking, cross-checking, whatever, that's a problem. But that's conscience. That's not regulation. That's conscience. If you didn't validate this answer, is it correct? This. That's conscience. So I think this is regulation overreach. But you're right, just like I should have gone to an Excel class long time ago, they should organize a course for how best for GPs to use AI in their practice. And you can use AI straight away for your record keeping. You can use it to dictate your notes into them. You can, what else you can do? You can cross-check your medication. Today, when I go on EMR and I order a drug, I get a pop-up that says, oh, you've had it for too long, or it's cross-reacting with something, or all that. Now, that is a kind of AI in there, right? That is a kind of, it is. Someone has fed in the information and is feeding you back what it's saying, right? So this is something similar. So AI is just like an extension. Okay, questions there.
All right. Question number 1. Instead of being worried about a Harvard graduate performing the surgery, how can Malaysian doctors embrace this inevitable shift towards AI? Sir, surgery, Mr. mentioned.
You just dive into it. So I'm not talking about AI replacing surgeons, no. I'm talking about surgeons upping their skill level, upping their knowledge level. Okay, that's what I'm talking about. Not just surgeons, any doctor, is upping it. Use the AI to understand this. So, like I said, I created this little ledger that tells me every year, my plan is every year, every year to upgrade the common diseases that I treat on the latest research on it. So I sound cleverer than the patient. But I've leveraged AI to give me that information, right? And we have to be in front of the game. If we choose to slip, somebody's going to walk over you.
Yeah, all right.
Well, we have another question before you look up on the screen from this gentleman.
Please, yeah.
Good morning, panelists. My name is CS, and I'm a pharmaceutical physician. I just have one comment and one question for Prof, and you highlighted a very important point. So ignorant AI is not an option, as you mentioned, it's a new baseline, right? And I'm very passionate about AI because I believe as clinicians, AI augment clinical decisions, right? And I'll forward that later. And what AI has been doing is it gives us more, which I don't think we address those that is not filled, which is the nuances of our clinical judgment that cannot be done by AI, and all the ethical issues. You can Google it, you will find those that humans, as you say, touch. And very importantly, if AI gets advanced, what it does to us as clinicians is precision medicine and personalized medicine, and it saves us time to address the patients and their time. I remember I was doing HKL ONG, we only scan and says, okay, what you need, come back in 1 month's time or 2 months' time, correct? With AI, probably you know everything about the things that you've done, right? You need to read just in 5 minutes rather than last time 1 hour. So you save that 55 minutes to address your patients. Now, Prof, you mentioned AI, which I am doing it now. As a subject matter expert like yourself, or the specialist in the floor, as a clinician, AI helps us from thesis, everything in just a snapshot, right? With the research of, I'm using Perplexity, and of course ChatGPT, Perplexity because it's academic and research-based, right? And Prof, you can look into the Perplexity, it helps. As a subject matter like yourself, it helps us. Now my question to you and the floor, and probably is, how are the newer generations, the students, the way they learn is through AI, right? They don't have to do all the research. Probably it's easier for them, but it may make them lazier. I have no answer. I have a 12-year-old kid. Lastly, to share with you, we search through Spotify, right? We click And he's so smart in the car, he just tap on it and just say, find me that song. In their era, that is AI, correct, Prof? So I'm going back to the floor and giving you back. What do you think the future for the students that don't have the subject matter expert, that it helps us, right? It augments our learning capability, but the new generation have no expertise or haven't done all this, and they are spoon-fed with that minimal one-pager where we have to do 10 journals to know that information like you. What do you think the newer generations would? Thanks.
I think, I really don't know the answer to your question, but it comes back to my nuclear holocaust theory, right? So in every level of our life, from the day you are born and you're in the kindergarten or even before that, to when you go to university in year 1, year 2, year 3, year 4, year 5, right? The academics need to identify now what is the core information you need to have. Okay, so the core information in year 1 anatomy may be different from what it was at my time. Okay, there are certain things that I need to know, right? And then as I go into clinical medicine, if there's an emergency, I need to know how to treat this. These are the investigations I need to know. These are the baseline. And that we need to know, and we can use AI to teach them that and tell them to find that information. And we need to examine them. And that's why I think, this is just my theory, I don't know whether it already been worked out by somebody more cleverer, is that there has to be a two-speed exam. You will sit for a paper called Paper A, Internal Medicine. You got no book, no computer, you just answer. That is what I think you need to know if something happens. And then B, in event, you can research the question, answer. They got open book exams. So similar to that. So I think that core has to be worked out by the human beings. Yeah, what you need to know, the basics. It can be basics in medicine, basics in engineering, basics in whatever topic lah. And then everything else is built on the top.
Yeah, I'm looking forward to a day where med school only takes 3 years instead of 5 to 6 years.
Thank you.
Okay, let's take the questions from the pigeonhole. Okay. So, probably, I'm a disruptive doctor. What master's certification do you recommend for us to take first in regards to AI, etc.?
All right. Can I answer this, bro?
Yeah, just a quick, briefly.
The first one is a master in AI for healthcare by KPJ Healthcare University. I'm
Support
serious
local.
because this is the first one and the only one at the moment. So if you have other choice, yes, okay.
Yeah.
But then I am the program coordinator. I developed it from doctors to doctors. So I make sure everything is covered.
Yeah.
Right? Okay, certificate. You have a lot of certificate. I agree with Prof. LinkedIn is one of the best place for you to get certification for free. All right, big data, IoT. Now it is Internet of Things, right? Now it's AI for things. And then, so I would go to LinkedIn, especially have their, next is Coursera. If you want to go, all these LMS or learning management system, they have free, but if you need physical or hands-on, please let me know. Because at KPJ Healthcare University, I also run the AI Academy, meaning we are focused on digital health and AI for healthcare. I have personally conducted a training for 1,644 staff from KPJ, our Center of Excellence, and then we have level or tiers, level 1, level 2, level 3. Level 3, we can be expert for at least the use of AI tools for healthcare.
Yeah.
Right.
So I think there are universities like IMU offering masters in medical informatics, and then RUMC also offers Bachelor of Medical Informatics. So these are some of the courses that you can consider. Prof, you want to add or?
Yeah. Can I be controversial and say, do you need certification? Unless you are doing something specific like programming and all those kind of things, do you need certification? Maybe as a general practitioner, you need to go for a cursus that tells you how best to use this. That's it. Right? I went for this cursus. Because we are so into this certification, right? Do we really? So with my Masters of Neurosurgery students, I taught them how to get their questions, how to fill up, okay? And they went on and they themselves figured out how to use AI to be a Viva expert, how to Q&A, how to analyze the questions from past questions, and they did all that on their own. There was no certificate involved, right? And then one of the students even decided how to renovate a house using AI after being taught the very basic.
Agreed.
I think it's just like Google. Did anyone certify you to use Google? You didn't. No. So, I don't know. Answer is I don't know. And by the time a certificate finishes in 4 years, you're already old already.
Yeah. True.
Right?
Obsolete.
Yeah. But perhaps for those who are interested in knowing the machinery of how it runs, and you want to develop those things, by all means go and get certified, right? Because I don't want someone without a certificate opening my head, right? So,
Okay, thanks for that. So very briefly, yes or no probably. Do you need to learn coding to know AI since there is many tools available out there?
All right, so can I answer you? Okay, like I mentioned before, no, you don't need to learn coding, but you need to know the concept of programming or the science behind it, physics and statistics and mathematics, but not to the level. If you want to employ or deploy this knowledge in healthcare, you can go and into specific statistics for healthcare, etc. No, I'm a codeless or no code enthusiast. So
all right.
No.
Just to make sure we are aligned to the theme of the conference as well, what are the career opportunities present within the medical fraternity after pursuing a master's in AI, health informatics, analytics? Is there a career path to this? Yeah.
I think you have a career for time span of about maybe 5 years. Because you are dealing with a generation of people who have no exposure or very little exposure of fear. So I'm an AI expert, so you must be the one-eyed man among the blind, right? And you can sell yourself to anything. Actually, world's your oyster at the moment.
All right.
From my side, I've been working with, currently I'm working with Cambridge, CCAIM, Center for Clinical AI in Medicine. Most of the doctors or clinicians there are programmers, and they have at least postgraduate certifications or postgraduate study in AI or digital health or health informatics, including programming. Johns Hopkins and Mayo Clinic, also the clinicians are very well versed in programming. But to the extent, like I mentioned before, you don't know how to code, but at the same time, if you are looking into the prospective careers afterwards, there are a lot and it will expand further when AI for healthcare really takes off. Now we are still in the embryonic stage of it. Later, expected within 2030, like mentioned by the Ministry of Digital Ministry yesterday, AI nation by 2030, healthcare is one of the core elements. So I think the perspective is massive.
All right. Unfortunately, we ran out of time. So those of you can run your prompt, ask your questions in your Gen AI tools. So thank you so much, Prof and Dr. Syahid, for your time, the insights, and for being part of this discussion. So remember, Gen AI is not here to replace the practice of medical practitioners. It's basically to, like one of the gentlemen mentioned, is to augment, to make care safer, to make the lives and jobs of practitioners more efficient and timely as well. All right? So thank you very much. Thanks, everyone. I think you can ask them questions on the floor. Thank you.
Right, thank
you so much,
Thank you, everybody.
Jason.